Dr. Katherine here with Action Potential Sport and Neuro Performance. I'm going to take Marcus through a warm-up. He's been having some elbow pain, so I want to get him warmed up before his workout. There are 3 spots that we want to hit. Usually when we have some elbow pain, it's going to be getting some isometric for the elbow itself. We want to hit the shoulder, and then we also want to hit the mid-back and the thoracic spine. So we're going to do a tricep extension here. We want to have the fist kind of up as you hold the band. And then what you're going to do is extend that elbow all the way, hold for a count of 5 seconds, and then you're going to slowly bring it back up to that neutral position. We do a ton of bicep work, and so we want to get some input to that tricep in order to offload the bicep a little bit and share the relationship between the 2 muscles. Okay, we're gonna go over a seated internal and external rotation with a weight for the shoulder. It's really important to address the shoulder with elbow pain because especially if we lack some motion, specifically in external rotation, it can put a lot of load onto that elbow and make it talk to you a little bit more. So what you're gonna do is you're gonna put your elbow kind of into the crevice of the knee, and then you want your palm facing forward with the weight, and then you're gonna slowly control that motion down, making sure that shoulder doesn't jut forward, and then hold at the bottom for a second, and then use the back side of the shoulder through here as you bring it into that external rotation. And that's the main thing of what you should feel. We're gonna do 8 to 10 reps of that where you feel a little bit of that burn on the back side of the shoulder. All right, now we're gonna address the thoracic spine. Why that is important is because it has a huge influence at your shoulders, which also will have an influence as far as for the elbow. We do a lot of overhead positions, so it's good to create some mobility and motion through that thoracic spine as well. So you're gonna take a med ball and a plate anywhere between 10 to 15 pounds. You're gonna lean back into that med ball. Arms are gonna go overhead, and then you're gonna slowly control that motion back. As you get to the top, hips are gonna rise up into a little bit of a bridge. Then you're gonna push your hips down. Think about someone's pulling your chest across the room, and then you're gonna return to that starting position to really feel a good stretch through that thoracic spine. I would do about 10 reps at a time. We wanna make sure these are nice and slow and controlled with each rep. Remember to take your rehab exercises nice and slow, especially when you're warming up. We want those nice and controlled movements to kind of give it our biggest bang for our buck. If you're struggling with any other injury or have any questions of anything going on that you have in the gym, go ahead and drop a comment or a question below and we will make sure to answer it.